Hi, this is Dr. Ravinder Singh, a board-certified neurologist and founder of the Beverly Hills Headache Institute. This institute is an integrative center where we combine the best of both Western and Eastern medicine. We have modalities such as acupuncture, homeopathy, Ayurvedic medicine, yoga therapy, chiropractic, and of course, neurology. So in this video, I want to focus on a condition that affects 30 to 40% of Americans and can cause a lot of chronic problems such as obesity, diabetes, heart attacks, strokes, and of course premature death. And what is this condition? It is chronic insomnia. So I wanted to discuss the treatment of chronic insomnia because in this country we focus a lot on medications. A lot of patients are taking medications to help them fall asleep, and that not only causes more problems with sleep, but actually causes more problems because of the medications themselves. So I wanted to focus on some natural treatments, and so I wanted to discuss this with our Ayurvedic practitioner, Dr. Manika Yadav.
Namaste everyone. Thank you Dr. Singh for inviting me today.
You're welcome. So let's talk about this condition called insomnia. So first of all, in Ayurvedic medicine, what does insomnia mean?
What actually happens in insomnia according to Ayurvedic perspective is the kinetic energy that's called as Vata energy in the body gets hyperactivated. And that person whose kinetic energy is hyperactivated, that person is not able to relax or lie down or sleep. So that person starts finding out different ways to keep himself or herself busy by reading something or going on the cell phone or going on the laptop, but doesn't get any rest throughout the night.
So they're basically pretty activated and they cannot calm their brain down to be able to fall asleep properly.
Exactly.
So what are some of the things that Ayurvedic medicine can do for these people?
If we keep the herbal medicines aside, then there are two ways we can control insomnia, we can treat insomnia. One is with the help of functional foods, other is with the lifestyle modification.
So what do you mean by functional foods?
Functional foods are just like medicines if they are used in a sensible way. For example, using milk and cinnamon together, warm milk. In warm milk, boiling say 2-3 pinches of cinnamon or half inch of stick of cinnamon. What this does is it helps to calm down, to pacify the nervous system.
Yeah, actually I remember when I was younger, when I was growing up in India, my mom used to make me drink warm milk at night and I used to hate it. But I guess there's a science behind it. Now I know that so drinking milk at night can actually be very helpful in helping you fall asleep.
Yes, not only drinking milk, people who cannot digest milk, who are intolerant towards milk, they can drink herbal teas, whatever they like, and in that herbal tea, they can add 1 teaspoon of clarified butter. This again helps to pacify the nervous system.
So the first thing is to drink milk, and you said to put a few sticks of cinnamon or pinches of cinnamon.
Pinches if it's in a powder form, or say half inch of cinnamon stick. Let the milk boil, and when it is lukewarm, the person can drink it during the bedtime.
Okay. So for people who are lactose intolerant or don't like milk for whatever reason, then you can drink some herbal teas.
With clarified butter.
With clarified butter. So 1 spoon of clarified butter.
1 teaspoon of clarified butter.
And it's a warm tea, not iced tea.
Warm. No. It always has to be warm. Anything that is warm will help you to sleep better. Anything that is oily will help to pacify, calm down the nervous system.
Okay. And I mentioned, I remember some days ago you mentioned putting some almond oil in the nose. Is that also very helpful?
Yes, that's a part of lifestyle modification. People who are not able to sleep well or have disturbed sleep during the night time, they can just put 3 to 4 drops of almond oil in both the nostrils, sniff it inside, and just lie down in the bed. There is one more thing that they can do is use mustard oil, warm mustard oil little bit, and apply it on their palms, do self massage on their hands, palms, and on their feet. This also helps to pacify the nervous system.
So mustard, is there something important about mustard oil? Has to be mustard oil, or could it be any other oil that you could use?
Any other oil can be used, but mustard oil has a typical quality that it penetrates inside the skin and it pulls away all the exertion, stress, or pacifies the nervous system.
I
So
see.
when you get up in the morning, you really feel refreshed and you feel like starting your day with full enthusiasm.
I know that, again, going back to India, I used to see people, they used to rub mustard oil both in their hands,
Yes.
massage their hands, but also on the bottom of their feet.
Yes.
And I've seen that in practice a long time, but I never used to do it myself. So I guess there's a science behind that too.
Yes, definitely. Most of the neurons that are there in the brain, their nerve endings end in our palms and in our soul. So when we self-massage these areas, we are activating those areas in our brain.
I guess that's also similar to the acupuncture points that we all know about.
Exactly.
Yeah, so this is a good way of activating all those acupuncture points, and this helps to fall asleep.
Exactly.
So I think that this is a good explanation of some of the natural treatments. Let me recap. The first one you said was drinking warm milk with 3 or 4 pinches of cinnamon. Second was drinking herbal teas with a spoonful of
Teaspoon of clarified butter.
clarified butter.
Yes.
And the third one was put 3 or 4 drops of almond oil in each nostril and sniff them. And the fourth one was to use mustard oil
Yes.
and massage them in your hands and in your feet.
Yes.
By the way, have you had any experience in treating our patients in this clinic?
Yes, we have had severe patients of insomnia. There was a patient who is in her late 50s and she wouldn't sleep for 48 hours, and if she would get sleep, she would sleep for 2 or 3 hours
Wow.
at a stretch. With that patient, we started her on mustard oil, clarified butter, and now she's able to sleep more than 4 hours every day, every night.
And she doesn't take any sleeping pills?
She doesn't take any sleeping pills.
Okay.
So this is about one case. We have had many such successes in our clinic.
Yeah, and that's true. These are the patients that I have referred to Dr. Manika because of chronic insomnia, and I did not want to prescribe any medications for them, so I was looking for a more natural alternative. And so far, it looks like these methods that Dr. Manika has talked about have been very helpful for these patients. So this is it for now. So I would like you to go home, and if you do suffer from this chronic condition and you want to try some of these methods, I would encourage you to go try whichever one you like, easiest for you, and then give us a call or go on our website and give us tell us about your experiences. Did this method work for you or not? And if not, what happened? And if it did, well, of course we want to hear about it. So until next time, be enlightened.